noticed with a lot of concern that Kenyan travelers have been facing a lot of indignification, because whenever they are traveling long distance, they are forced to stop by the roadside and hit the bush to go and relieve themselves. It is therefore in this spirit of getting in alignment with the SDGs that we try to reduce open defecation, that I came up with a motion which I tabled, I moved, and was debated and adopted by the Senate, that was recommending establishment of service points along the main highways so that our people, our travelers who uses public means can be dignified. The essence of the idea, the whole idea behind the motion was to have a partnership between the private and the public sector, where we establish such a centers that will open space up for mothers who have small children, places that can change diapers, places that can breastfeed, and most importantly, secure places where people can be able to relieve themselves or even park their cars and rest. The idea behind it was to engage the local community so they can be manning such a service points, and it will also be another form of income, but most importantly, dignifying the road users. We know that the advanced countries, this is one of the places that where they even put the hotlines, where somebody in an emergency situation would make a stop and call for an ambulance, call for police assistance, or call even for emergency doctors if they need medical attention. Therefore, in the advent of now the widespread digital highways, it would be also a place where we can install even maybe cameras along the stations, so that you can be monitoring the number of cars, their registration, the passengers inside using the road, and this will go also a long way to enhance the personal security of the passengers using those vehicles and manning those stations, but most importantly also establishing hotlines where people can be able to access in quick intervention from emergency services like fire brigade, like ambulances, and other medical services which may be required. You do not start an emergency hospital on the highway. What you do is you establish first aid centers along those areas that can be manned by the local communities, that can be able to give the first attention of somebody who's been involved maybe in an accident, somebody who requires medical attention, awaiting ambulances to come. And this can also be hubs where you can also park the ambulances, as is in the developed countries. These are also areas where you put fire brigades, you put police cars, so that they can be able to be dispatched on quick and short notices. Indeed, it is not even a question of the cost in itself, because it being a public-private partnership, there'll be other elements alongside the facility, like petrol stations can be incorporated. We can also incorporate private clinics. We can also incorporate hotels and such facilities, eataries, so that in itself it becomes self-financing. The most important factor is to ensure that in areas that are not highly populated, then we would have the road users having a secure place to use. The cost in itself can be justified, because there is nothing as more as expensive as indignifying somebody where you have road users traveling in the same bus with children, with women, and then they have to use an open field to help themselves, to relieve themselves. It can be quite indignifying. Therefore, I think the social impact of the same will justify whichever cost which go into it.